Again. Today is our 2093rd day of continuous webinar.
Okay.
For the last 2092 days, we are conducting this webinar without any break. Thank you all the participants and faculties for your support and participation here. Today's our lecture is PANKAJ and LATHIA. He is MD and Ph.D. in Homeopathy. He is HOD and Professor in the Department of Community Medicine. And he's a PhD guide, chief consultant of homeopathic clinic, and he have 15 years of clinical experience and 13 years of teaching experience, written many articles and magazines, and winner of many awards and judge of some leading schools I'm welcoming Dr. PANKAJ for today's webinar. Dr. PANKAJ, you are most welcome and happy to, and we are expressing our happiness to get you as today's lecture. Dr. PANKAJ.
Yes, ma'am. Thank you, madam.
And can you open your camera, sir?
Yes, ma'am. Thank you so much for nice introduction. Can I share my PPT, madam?
Sure.
Okay. Madam, are you able to see?
Yes, your profile, right?
Am I audible?
Yes, audible.
Okay.
You're visible.
Can I start? Okay. So, good evening, everyone. Let's start today's session. Today, I'm going to present a very interesting session and very interesting topic. The individualized approach, evidence-based outcome in complex dermatological pathologies. As you all know that dermatological disorders are among the most challenging conditions in clinical homeopathy because skin problems are often connected to a person's overall health and constitution. Skin diseases such as chronic inflammation, allergies, and autoimmune conditions are usually not just surface level problems. They may reflect deeper internal imbalances within the body. In homeopathy, the skin is considered an important medium through which the body expresses its internal disturbance. Therefore, understanding the patient as a whole, including physical, mental, and emotional aspect, is essential for effective and long-lasting management of complex dermatological conditions. Main three parts are very important in our daily routine practice. One, pathological complexity means conditions such as psoriasis, eczema, lichen planus, pompolix involves multi-dimensional etiologies requiring holistic case analysis. Second, individualization. Simillimum selection is guided by totality of symptoms, physical, mental, and characteristic particular, not the disease level alone. And third one, evidence-based outcome. Treatment outcomes are assessed using before and after photographs, helping to evaluate the effectiveness of homeopathic treatment in complex skin disorders. In the homeopathic framework, no two patients with psoriasis, pemphigus, or acne rosacea are treated identically because treatment is based on the individual patient rather than only the disease. According to Samuel Hahnemann, in the organ of medicine, the physician must understand the totality of symptoms as the true representative of the disease in its entirety. This principle is especially important in dermatology, where skin diseases are believed to reflect deeper internal disturbances, including miasmatic influence, emotional stress, dietary factors, inherited tendencies, and constitutional susceptibility. So these all are the factors which are responsible to develop the skin disease. So before starting case study, I would like to share our aphorism number 1. The physician's eye and only mission is to restore the sick to health, to cure age it is done. Homeopathic prescribing therefore focuses on individuals' constitutional treatment rather than disease-based management alone. Along with accurate remedy selection, proper posology, including choice of potency, dosage, and repetition, plays a vital role in successful case management. These decisions are guided by the patient's susceptibility, vitality, and chronicity of the disease and response to treatment. Careful evaluation of these factors helps in achieving a gentle and holistic restoration of health with improvement not only in skin lesion but also in the patient's overall well-being and quality of life. Let's see cases, and I want interactive session, so I will ask you totality, diagnosis, so be alert in between case study. Okay. So let's start case 1. Patient name is XYZ, 23 years old female, having complaint of blister formation on sole, hand, feet since 1 year. There are itching and burning, having watery and sticky discharge. Blisters are painful, difficulty in walking and working, relieved by allopathic drugs but temporary relief, and steroid injections, relieved by cold water. No having any time modalities. These are the chief complaint of the patient. See photographs of the patient. Patient came to my clinic with this presentation. You can see blister formation over the sole, palmar surface, plantar surface, hand. Okay. So anyone can say, what is the diagnosis of the patient? Please text the message. What is the diagnosis of the patient? Anyone, please take the message. Hello. Am I audible, madam? Okay. Diagnosis of the patient. Please text the message. Bulla, okay. Anyone? Anything else? Yes, anyone? Complex, okay. Okay, let's see what is the diagnosis of the patient. Diagnosis of the patient, complex. This is one type of eczema and it is because of allergic condition. Okay, so let's see another history. Past history, abdominal discomfort, gas and acidity, family history, both father and brother had eczema. Physical general, significant physical general, patients having a thirst, likes cold water, desire for sour and salt ice cream, aversion sweet and milk, and thermal, ambithermal towards chili. Mental symptoms. I asked to patient, tell me about your nature. Patient said, my nature is very good. I like being with everyone and people also like being with me. I mix with people very quickly. I am very talkative. Even if strangers are around, I easily start conversation with them. They never feel like I am an outsider even with you. Even with you, see how comfortably I mix within just 10 minutes. So I asked, tell me more about your nature. Patient said, if someone at home says something hurtful to me, I feel very bad. I keep thinking, why did they say this to me? And I feel like crying. I asked, why is that? Patient said, because from my side, I always think good for everyone. Whenever family members, friends, neighbors, anyone need help, I help them no matter what situation I am in. Even if I have only 50 rupees, I would still give 40 rupees to someone else. But even after doing so much for others, people still don't understand us. No one really cares for us. Even the people whom we help are not there when we need help. That hurts. But later I forgot it and let it go. In life, one should keep a big heart. So I said, but even if no one helps you, why do you still help other? Patient said, my nature itself is very emotional and sensitive. I feel pity very quickly. Even when I see small children wandering on the streets, I start thinking, poor child, do they even get enough food to eat? Sometimes I give them food. Whenever I see poor people or small children, I immediately feel sympathy for them. I love small children very much. Even if a child is crying a lot, if they come to me, they calm down quickly. So this is the basic nature of the patient. Okay. Then I ask, tell me about more. Patient says, I have told you whatever was there. Now you can ask whatever else you want to know. Then I have asked specific question about anger, not significant. Patient had fear of water, dreams recurrent and frequent, like anxiety. Yes, I do have an anxious nature. I worry a lot about my family members. If someone comes home late or goes out somewhere, I keep thinking what might have happened. If my father falls sick, I become very worried and thinking what will happen now and keep hoping that he gets better soon. I asked, tell me more about your anxiety. Patient said, whatever happens to me, I do not worry much about it. I am strong. I can tolerate my own problems, but I keep thinking that nothing should happen to my family members because if they suffer or face any problem, I cannot tolerate it. I become very tense and anxious. So these all about the patient's nature. Okay, anyone can say totality of symptoms rubric, whatever you understand, please text the message. Totality of symptoms. Present your totality, then we will discuss. Yes, anyone? Please text the message. Okay. One said medicine phosphorus, sympathy for any situation. Okay. Anything else? So sympathy is a hallmark in entire case. One doctor said medicine phosphorus. Okay, good. Okay. Anyone can say what are the entry points in this case? What are the entry points? There are so many rubrics, so many sign and symptoms. We have to find out entry points of the cases. Okay, let's discuss. Okay, so these all are the entry point from my side. Patient is very caring and helping, sympathetic, mixing, and extrovert 3 mark, affectionate, and emotional. Also, there are significant physical generals, characteristic particulars, but these all are the entry points of the medicine in this case. Okay, so I have prescribed medicine, myasm, sora, and syphilis. Phosphorus 201 dose stat and SL for 10 days. Then I have repeated medicine at every 15 days, then weekly, then 3 doses every 15 days, and then 3 doses weekly. And at last, I have prescribed phosphorus 1 m 1 dose every 15 days. As per required, I repeated doses. Let's see result of the phosphorus. Follow-up criteria. I have to ask about new lesions. all lesions and size of the lesions. Okay. So this is the photographs of before blister formation. After 2 months, there were severe aggravation. All blisters came out because of the suppression. These all suppressed by steroid injection. Okay. So before and after condition worse. Okay. After 4 months, all blister burst out and discharges came out. Okay. See photographs, all blisters burst. After 6 months, there are started of healing. You can see new tissue and cells are generated or scaling and discharges all were removed. After 9 months, all lesion, all blisters totally removed and also improvement of the skin. So you can see before, after 2 months, after 4 months, after 2 months, there were severe aggravation. It is a very crucial time for patients. After 4 months, blisters burst out. After 6 months, improvement started. And after 9 months, patients got wonderful result with phosphorus. Okay, this is the photographs of hand. Blisters before, after 2 months, after 6 months, and after 9 months. The patient got wonderful result within 9 months with help of phosphorus. This is the beauty of homeopathy. Okay, let's see second case. This is a case of hopeless female age of 28 years, married since 6 years, working as a housewife in joint family and came with complaint of cracks and fissure in both hands, itching 3 mark, thick skin, dryness 3 mark, and occasionally bleeding since 2 years. Itching aggravated by fermented food detergent and relieved by allopathic medicine and ointment. There is no any changes age per season, food or water. Associate complaint, frontal headache, throbbing pain aggravated by soaping, sun and fasting. These are the associate complaint. Okay, so this is the first visit. You can see after 1 month, there were severe aggravation. Okay, anyone can say what is the diagnosis of the patient? Okay, anyone can say, please take the message. What is the diagnosis of the patient? Any idea? Please take the message. Whatever you know. Atopic dermatitis. Okay, good. Atopic dermatitis. Second, anyone? Palmar dermatitis. Okay, good. Palmar dermatitis, atopic dermatitis, Palmar keratoderma. Okay. Palmar keratosis. Okay. Okay, good. So this is a case of Palmar keratoderma. Okay. Past history not significant. Family history, mother had having is having eczema and father is having hypertension. Grandmother, similar complaint, plantar keratoderma. Physical general, significant physical general, desire ice cream 2 mark, spicy 3 mark, pica 2 mark during childhood, and aversion milk 3 mark. Also, there are significant sleep occasionally disturbed because of thoughts about the illness. What if it is never gets cured? I don't feel like it will ever go away. Everyone says this disease never completely heals. What if my children also get it in the future? So these are the anticipatory anxiety, and patient is hot. Let's see nature of the patient. The patient belongs to a middle class family and lives in the joint family. Both her maternal and paternal families were peaceful and everything was normal before the onset of this illness. However, after marriage, when the illness began, problems started arising within the joint family. People gradually started ignoring her, and no one was willing to eat the food cooked by her because of the illness. Due to this neglect and ignorance, she felt deeply hurt, leading to sadness and weeping when alone in her room. She constantly kept thinking, especially while alone or before sleep, why has this happened only to me? What is my fault that everyone treats me this way? Such thoughts made her feel very miserable. So these are the basic core of the patient. At times, she even had thoughts of dying, but whenever she thought about her children, she somehow managed to overcome those thoughts. She repeatedly felt this disease will never get cured. She consulted 3 to 4 allopathic doctors, and all of them assured her that she would recover. But since there was no improvement, she gradually lost hope and became mentally exhausted. She constantly kept thinking about her condition and remained sad. Sometimes, when she could not control her emotion, she would go into her room and cry alone. Even after coming for homeopathic treatment, people around her would say, can this ever be cured with homeopathy? Instead, consult some better doctor. Hearing such comments made her feel even more hurt, hopeless, and depressed. I asked her anything else. She told me, after this illness, my mind has become very irritable and angry. During childhood, I was very calm, but now I get angry over small things in a joint family. I cannot express my anger openly, otherwise, they may send me back to my parental home. And why should I make my parents unhappy because of me? So sometimes when I can't express my anger, I end up taking it out on my children by scolding or hitting them when they don't listen to me. I asked about anxiety. She told me, I constantly worry whether this disease will ever get cured or not. Even after trying so much, there has been no recovery. Now my mind feels that it will never get cured. Sometimes I even fear that this illness may turn into cancer or some other serious disease. Such thoughts make me feel very low and depressed. My mind becomes sad and I lose interest in work and I am unable to sleep properly. This is all about the nature of the patients. She also expressed anxiety about her children and future. What will happen to my children in future? What if they also develop some illness? Whenever there is any plan to go somewhere outside, even if I sleep at night, my mind remains active from around 3 a.m. onwards. Continuous planning keeps going on in my mind. Whether everyone will wake up on time, live on time, reach safely, and whether something bad like an accident might happen on the way. Seeing such incidents also brings these thoughts into my mind. So these are the anticipation again. Fear, robbers, remark feels that robbers may come into the house and trouble the families. Also fear of reprimands, sensitive to noise, even if someone speaks loudly or utensils falls suddenly, she gets started easily. Dreams, snacks, robbers, and dead person. Interpersonal relation good with everyone. There is no problem from my side. Okay, diagnosis, palmar keratoderma with gerosis. Let's see totality. Yes, anyone can say. Nucleus of the patients, core of the case. What are you thinking? Please take the message. Yes, anyone? Please take the message. What will be core of the patient? Hopeless of illness. Okay, good. Hopelessness. Anxiety about disease. Okay, good. Anticipation and anxiety. Hallmark. Anxiety family about. Okay, very good. anxiety, anticipation, hopelessness, elements from steroidal ointment, anxiety child about, okay, okay. Anyone can say medicine, which medicine you are in your mind, natrum salt, okay, very near to patient, natrum salt. Despite spilling, legacies, arsenic alb, okay, okay, good, good, good. Okay, let's see. So these are the totality of symptoms. Anger, suppress, sadness causing weeping, pessimistic, hopeless, despair about recovery, weeping when alone, thinking persistent, sensitive to noise and reprimand, fear robbers, dream snake robbers and dead person, anticipatory anxiety, children and future illness, aversion, milk and headache, fasting and sun, and patient is hot. So these all are the symptoms of natrum group. So one doctor said natrum sulf. So in natrum sulf, there are issue of appreciation because of sulfur. Sulfur patient is having ego. They are doing so much for family and also they wants returns. So when they didn't get returns, then they speak. I have done so many things for my family, but I have no any appreciation. I never appreciated by anyone. So this type of want of appreciation, it is a main core of the natrum sulf. And natrum sulf, it is a one of the practical medicine in group of natrum. Emotional remedy, there are two most emotional remedy, natrum phos and natrum mur. And natrum sulf and natrum carb both are practical remedy. All natrums are hypersensitive, emotional, oversensitive, but natrum sulf and natrum carb are very practical, especially in the group of natrum. Okay. So I prescribe mahism psychosyphilitic. I have prescribed medicine natrum mur. Natrum mur 201 dose every 15 days. Natrum mur 201 dose every week. Then natrum mur 203 dose every 15 days. And last, natrum mur 1M1 dose. Increase is all complete as per required. I repeat, natrum mur 200 from 1 dose to 3 dose to 5 dose. Okay. So this is the picture of the patient. You can see first visit. All complaint aggravated after 1 month. After 2 months, there are totally exfoliation of the skin and dead skins was removed. After 4 months, more than 70% improvement. After 5 months, only few patches were remaining. After 7 months, most of the case was clear. And after 9 months, patient was very happy. See, after 1 month's photo and after 9 months photo. All swelling, dead skin, totally cracks, fissure were removed. All are clear. Okay. These are the back side of the photo. There are swelling, cracks, also dead skin, xerosis, dryness. After 2 months, more than 70% is removed. After 7 months, most of the case was cleared. And after 9 months, patient got wonderful result. This is because of natrum mur and homeopathy before and after. Okay, swelling totally reduced because of cracks and fissure was cleared. Okay, let's see third case. A 48 years old male patient came to me with complaints of crusty lesion over scalp. Along with red and scaly skin surrounding the lesion, there was a very offensive odor from the discharge, which was bloody and sticky in nature. When the patient entered my OPD, the smell was so offensive that it felt as if a dead fish had been brought into the room. This is a peculiar offensive smell. Remember, it will be helpful to select the final remedy. Okay, the patient had been suffering from this complaint for years and had taken allopathic treatment for nearly 1 year. 3 years earlier, he had been diagnosed with pemphigus by dermatologist. The condition was aggravated during winter and relieved by warm application. Itching and burning were more intense at night. These are the presentation of the patient. On examination, left temporal large crusty lesion, thick leather-like layer of skin, most because of discharge surrounding lesion, and felt offensiveness. Okay, anyone can say what is the diagnosis of the patient? Pemphigus. Okay, pemphigus. Anything else? One doctor said Majorem medicine. Okay, Majorem it is a good for skin, especially thick leather-like layer. Okay, anything else? Any other medicine? Any other medicine? Okay, arsenic alb, wonderful. Lachesis, okay, good. Sorry. Majorem, okay. Anything else? Anyone? Tuberculinum, okay. Let's see. Okay, arsenic. I have already told you skin lesion, it is not a local lesion, it is a mainly manifestation from a internal disturbance. So I never prescribe any specific medicine for any disease. I always prefer constitutional remedy, CR, and I covered person as a whole and I prescribe medicine. So I will get more than 80% result in dermatological practice. Okay, let's see. Past history typhoid and malaria before 20 years. Family history father is having psoriasis and mother is having eczema. Physical general appetite 3 times per day. Thirst wants cold water. Desire cold drinks 3 mark. Pungent things, warm food, milk, and aversion sweet. Stool, especially diarrhea after ice cream and raw milk. Perspiration profuse during summer. Offensive odor, especially when wears socks. And in the evening, when the shoes are removed, he feels like keeping the shoes on all the time. Thermal chilling. So offensiveness, offensive odor from the perspiration, offensive odor from the disease condition, discharges, offensiveness is the general hallmark symptoms. We have to consider offensiveness first. I asked about nature. How is your nature? Patient said earlier my nature was very good, but after this illness, nothing feels good anymore. And thoughts keep coming to my mind. What kind of thoughts do you get? I have taken so many medicine, but nothing is improving. So I keep thinking whether this disease will ever get cured or not. What will happen if it never get cured? Whenever I go, people keep asking about it and I get tired of answering them. Sometimes I become irritated and angry. Then I asked, why do you feel that it may not get cured? Patient said, whenever I take allopathic treatment, it feels better for some time, but then it becomes the same again. Many times I feel afraid thinking, what if this turns into something serious? If a major disease develops, then what will happen to my family? So I asked, what do you mean by serious disease? Patient said, what else, sir? These days we hear about cancer everywhere. So I feel maybe my blood has become infected or spoiled because of this foul smell and discharge. I keep hearing that it might turn into cancer. I asked, why are you so afraid of cancer? Patient said, because cancer may not get cured and the whole family savings may get exhausted in treatment. Money gets spent, yet recovery may still not happen. From a very young age, I came to Surat to earn money. Since childhood, I have worked day and night only for money and for my family. Now I don't like the thought of all that hard-earned money getting wasted like this. And because of me, my family will also suffer and face difficulty. So here, this is the clear-cut, not fear of cancer, but This is the anxiety about money matters with fear of cancer. Other mentals, anxiety about family, health, money matter, more felt during sleep. Fear, death, and disease. Careful in business, afraid to take any risk. Fear of losing money. Patient count money 2 to 3 times, and even he has habit of checking log 3 to 4 times. So this is a one type of OCD trait, not a clear-cut OCD, but this is a starting phase. Okay, anyone can say this is a case of pemphigus. Agaricus medicine, Merxol medicine, arsenic medicine. Okay. What will be core of the patient? Which is the main rubric which we have to consider? Okay, silica. Anyone? Okay. Take responsibility too seriously, right? Money matters. Very good. Anything else? Okay, let's see. These are the totality of symptoms. Anxiety, family, health, money. Anxiety felt at night during sleep. Fear, death, incurable disease like cancer. Despair about recovery. Careful, checking twice or more. Mentally, insecurity. Discharge, offensive. Bloody and sticky. Perspiration, offensive. These are cold drinks, milk, warm, pungent things. Aversion, sweet. Thirst, cold water. Chilly, diarrhea, aggravated by ice cream and raw milk, itching and burning, aggravated by night and warm application, which will better. Okay, by warm application. The myasm, clear cut syphilitic. Also, there are syphilitic traits in the patient, like a OCD. Remedy, I have started this case with intercurrent remedy, syphilinum, because of there are strong syphilitic myasm. So I have started this case with intercurrent remedy syphilinum, 1 m, 1 dose, and after 24 hours, I have prescribed arsenic alb 200. Arsenic covers all types of anxiety, all types of fear, and also anxiety about money matters and offensiveness, hallmark. If you read Kent Materia Medica, lecture on Materia Medica by Kent, Kent has written arsenic patient if enter in our OPD or if we enter in arsenic patient's room, then we felt smell, especially like a cadaverous smell, like a dead body smell. This type of offensiveness will be there. So this is the hallmark in patient. So I prescribe arsenic. I repeated dose as per required. Also, I repeated dose arsenic 1 m 3 doses weekly because there are severe disease, so repetition also must. See, before pemphigus lesion, after 3 months, you can see there are totally exfoliation of the skin and also crusty lesions will that was reduced. After 6 months, you see there are healing started. You can see bloody patches in between. That is a healing of the skin. After 9 months, I think 50% lesions was clear. After 11 months, more than 70% lesions was clear. And after 12 months, over the 90% patients get relief. Okay. And after 14 months, patient get wonderful result with arsenic al. Okay. So before and after, you can see within 14 months, patient got wonderful result with help of arsenic al and intercurrent remedy syphilinum. Last case, History: a 35 years old male patient came to me with the complaints of large reddish flecks and scaly lesion over chest and abdomen with severe itching. Aggravated at night during winter and cold damp weather. You can see picture of the patient. Okay, anyone can say diagnosis of the patient? Diagnosis of the patient, anyone? Please take the message. Psoriasis, okay, good. Okay. So this is a reddish flex type of psoriasis. Let's see history. Before 5 years, patient had conflict with his fiancée and ends in breakup after 6 months. Patient had good attachment with her, but she had relation with her boyfriend even after engagement. When patient got this news from his relative, patient was shocked and felt very sad and get angry over her, but could not express his anger and constantly think about her. Could not say anything to his family. Once he said all things to his father and decided to break up. After that, he had faced lots of problems in his life, like disturbed sleep, aversion to people, indisposed to talk, loss of appetite, lacking of concentration in work, suicidal thoughts. These all are the symptoms which was arise after the breakup with the fiancé. Suddenly, he started to difficult in breathing, gabramon, and suffocation after 6 months of breakup. He was diagnosed by MD doctor as an asthma and started inhaler and steroids. Asthmatic attack was resolved within 6 months and stopped all the treatment, but he has started few reddish, scaly, and itchy lesion over the chest and abdomen after 1 year. He consulted to dermatologists and diagnosed as a psoriasis. He had given allopathic medicine and ointment. Patient took this allopathic treatment for 1 year, but only get temporary relief. So he stopped to take anything since 6 months. And by reference of one general practitioner, he came to me. I have taken case in detail, but case was very long and descriptive. So we will see in a short way. ODP incidents breakup in 2015. Bronchial asthma started 6 months treated by allopathic treatment. Psoriasis after taking 1 year of treatment of asthma and taken 1 year allopathic treatment for psoriasis. Now patient don't take any treatment. Physical journals, significant physical journals. Desire sweet, aversion milk, fruits, perspiration profuse in axillary and offensive, and thermal chilling. By nature, patient was very anxious and nervous. He belongs to middle family. He had lots of stress related to money, health, and family and job. He was disturbed because of this illness. He was thinking that I had so many problems, what I did wrong. He reproaches himself for everything. He told me I am suffered because may I did wrong with others. Actually, he didn't. He was very honest, polite person. Didn't do wrong with anyone. Even he was sympathetic towards needy people. He helped a lot to friends and relatives. He always find fault within himself for anything and blame on himself that I am responsible for everything. Even he didn't blame to his fiancée for breakup. He reproaches himself for that incident and everything he didn't want to do wrong for anyone. So this is the basic nature of the patient, reproaches himself. Okay, and he thought that he has done wrong. He is very honest and polite person. Also, he is anxiety about money, health, and family because basic nature of the patient very anxious and nervous. He had fear of contagious disease during school time. He didn't approach and touch to his one school friend suffered from psoriasis. And now patient has similar complaint of. So he felt and thought very bad. He said that now I feel that what was feeling of my friend. Patient had dreams of robbers 3 to 4 times. When I asked about incident that, have you any incident that you want to forget but can't? Patient said, I am still unmarried, so I remember that incident when I see other couple on road. Sometimes felt very bad inside and it make me emotional, leads to weeping, but cried when alone. So again, this is a basic nature, contagious disease fear, and also patient fear dreams of robbers. Okay, totality of symptoms. Anyone can say, please take the message. What are the symptoms and which are the remedy? Psoriasis, the diagnosis. Okay, core and nucleus of the case and this patient.
Head trauma.
Psoriasis. Okay, please take the message.
Tetramoron.
Yeah, anxious and nervous, robbers, dreams, Steffi, right? Steffi, disappointment, love, maybe Netrum Mure, Netrum Sulf, Dalcamara. Okay, good. Okay, nice. Reproaches himself. That is the core of the patient. Netrum Mure, right? So you all are right. Netrum is a very close to the patient, but we have to differentiate all the netrum from each other. Okay. So here, totality of the symptoms, elements from suppressed emotion, elements from disappointment, elements from silent grief, anxiety of conscience, what is right, what is wrong, that is one type of anxiety. Anxiety about family health, conscientious about trifles, delusion, he has done wrong, fear of contagion, silent grief, reproaching oneself, sadness, weeping when alone, dreams of robbers, perspiration offensive, desire sweet, aversion milk and fruit, and chili passion. So definitely netrum comes to close, but remember one part is netrum like suppressed emotion, disappointment, silent grief. Okay, but on another part, you can see there are anxiety of conscience and conscientious about triples. Also, there are great anxiety about families and health. Also, there are offensive perspiration and fear of contagion and reproaching oneself. This is the keynote of the totality, which differentiate Netrum group. I prescribe Netrum Ars because another part is very close to arsenicum. Okay. So Netrum, right? Psychosyphilitic miasm. I have started with Sorinum 1M 1 dose as an intercurrent remedy in my intercurrent remedy because there are suppression and history of psoriasis. Also, patient is having complaint of psoriasis. In my mind, arsenic, aurum, natrum, carcinosin, staphy, all are the remedy which came in my mind. But then I repertorize case and read Materia Medica. I started to find out remedy natrum ars from different book because there are very small literature about the natrum ars. But in repertorization, natrum and arsenic both are very close. So I found this remedy from Phatak Boric, but with very short description. Then I read from Prisma, which is written by Franz Vermeulen. Okay. So see repertorization. I was confused, so I repertorized the entire case. Natrum mure and arsenic both are very close remedy. Both are covered 11 and 12 rubrics and 22 or 21 mark. So which are the final remedy? Then I have seen that one portion is close to natrum, second portion is close to arsenic. Then I started to read Materia Medica and I read Natrum Ars from Prisma, which was written by Franz Vermeulen. And I have prescribed Natrum Ars 201 dose TET and SL for 15 days. As per required, I repeated same medicine for 1 year. Natrum Ars 201 dose weekly. Natrum Ars 203 dose every 15 days. Then weekly. And at last, Natrum Ars 1M 1 dose weekly. After 4 months of treatment, patient experienced severe attack of asthma in January 2016. So I have taken acute totality, severe difficulty in breathing, dyspnea, aggravation lying down at night, relieved open air, and relieved by sitting. One examination, bilateral wrong eye. So I prescribe arsenic alb 30 DDS 3 days for 1 week. It is an acute remedy for asthma in that patient. So I prescribe acute remedy. After 1 week, patient feels 50% better. I prescribe SL 1 week. After 2 days, again attack of asthma. So this is a past history of suppression, especially by steroid and inhaler. Okay. Again, I prescribe arsenic alb 201 dose daily for 3 days and SL for 1 week. After 1 week, 70% better. I prescribe SL 1 week, and after feeling better, no repetition of acute, I repeated constitutional medicine. So this is the acute episode in between the chronic case. So see, result of Natrum arcs before reddish, large, multiple patches over the trunk and chest. After 2 months, all complaints were increased. After homeopathic remedy, this is the common. After 5 months, most of the patches was cleared. Only after 8 months, only blackish discoloration was remaining. After 12 months, most of the plaques, reddish eruption, all blackish skins was cleared. And after 15 months, patient got completely improvement. Okay. So this is a before and after. So within 15 months, patient got wonderful result with help of Natrum ars, constitutional medicine, and Soranum intercurrent remedy. Homeopathy, when practiced according to its fundamental principles, including individualization, miasmatic understanding, susceptibility-based pathology, and careful follow-ups, can provide a meaningful, safe, and patient-centered approach in the management of complex dermatological disorders. The cases presented in this series are not intended to be seen as rare or exceptional outcome, but rather as example of what systematic and disciplined homeopathic practice can achieve when applied consistently and scientifically. Collectively, these cases support the classical homeopathic understanding that chronic skin disease, despite their complexity and recurrent nature, responds positively to individualized constitutional treatment. In homeopathy, the skin is not viewed merely as the site of disease, but as an expression of deeper internal imbalance. Therefore, management requires more than treating visible lesion alone. It demands a holistic understanding of the patient's physical symptoms, mental and emotional state, susceptibility, and overall constitution. Such an approach enables the homeopathic physician to address the patients as a whole, aiming not only for improvement in dermatological symptoms, but also for long-term restoration of the general health and well-being. So before starting my session, I read aphorism number 1, and at the end of session, I would like to say aphorism number 2. The highest ideal of cure is rapid, gentle, and permanent restoration of the health. Thank you. Over to you, madam.
Thank you, Dr. Pankaj. It was a wonderful session, and the cases we are seeing here is miraculous cure of homeopathy. Even we appreciate you for your confidence to treat such cases. Really, really wonderful. And mostly the skin disease, we need patience, and we have to console the patient to hold the treatment, because they'll get disturbed within 1 month. They'll get disturbed, and I'm really appreciating your. It's really it's ideal cure, complete restoration of the normal skin. Wonderful case presentation. That it gives us confidence. Thank you so much. And Dr. Ram Parvesha sir want to say something. Sir, please.
Thank you.
Thank you, Dr. Anjani, and congratulations.
Thank you,
Dr. Pankaj sir. Very nice, wonderful case, evident, best case, and in his life treatment, homeopathic approach. Homeopathic is the role of skin disease, very good. According to organon, so according to the organal philosophy, homeopathic gently, rapidly, and permanently cure. So approach individualized, constitutional, and rule of miasmatic. So very thanks, Dr.
Thank you,
Pankaj
sir.
sir. Thank you.
Dr. Pankaj, can you
Yes.
please stop screen sharing?
Yes, ma'am.
Dr. Pankaj, it was really a very good session. The right way to choose the right medicine.
Okay.
And you show how a homeopathic doctor need to change his attitude even after getting the simulacrum in the first repertorization. But when you look at the materia medica, you can see the difference that there is the natron compound and arsenic compound. Both are different substances, and when both of them united, the person may have a different personality, and that's the reason why you were able to get that medicine in the right patch. And what was the reason for you to prescribe Solinum in the beginning? Is there any specific reason for you to prescribe Solinum?
Hello, sir. Pardon?
is-
Sorinum?
Is there any specific reason?
No, sir. No, sir. I have no, but I have seen that in a chronic disease, intercurrent remedy with constitutional remedy will get wonderful result. So I have used more than 20 intercurrent remedy, medurinum, TUB, basilinum, sorinum, sipilinum, before starting constitutional medicine. And after 24 hours, I will prescribe constitutional remedy.
Yes, that's a good thing. No problem. There is nothing wrong in that. It's just because those who want to study homeopathy can note all this thing. That's the reason why I asked the question.
Yes, sir.
Vivek, congrats.
Thank you.
Thank you. I think
The video will be shared tomorrow, so you can share with your students and friends so that please ask all of them to subscribe the same because we are not paying anything for that.
Definitely.
Thank you.
thank you so much, Dr. Pankaj, for your presentation. Thank you, all the participants of English session.
Thank you.
See you the same time tomorrow. Now we are moving to the Malayalam session. I am inviting Dr. Shaila for moderating Malayalam session. Good night to everyone. Over to you, Dr. Shaila. You're welcome.